Hey everyone, it's Drew here back at FFAS 2018. I'm joined by Dr. Somenek from Washington, right?
You got it.
Thanks for joining us.
Thank you for having me.
Yeah, absolutely. How's the show going so far?
It's going really well. You know, I got here yesterday. We have 3 tracks, which I think is really great. It caters to everyone's needs.
Mm-hmm.
There's the surgical track, and if something doesn't cater to you in that track, we have the non-surgical track, which has been really busy today. That's the one that I'm speaking at and have a couple talks with. So,
Okay.
And then there's the practice management, which is really good for those private practitioners that are
Sure.
looking to expand their business.
Sure. Talk to me a little bit about the presentations you're going to be giving.
Sure. So I talked earlier about the male aesthetic.
Okay.
And I really like to focus on what makes a male, you know, in
Sure,
terms of their
sure.
facial features and what we need to focus on when we assess them surgically and even non-surgically.
Okay.
So I gave the talk with that. Everyone really liked it because I provide humor with my talks as well. I don't want to
Okay.
make them too boring. I don't
I
want
like
to see
it.
anybody sleeping in there.
Sure,
And
sure.
I like to keep people engaged.
Yeah. So tell me then a little bit. So the male, even today, I still feel like that male market's underserved. Would you agree?
Definitely. You know,
Yeah.
males definitely are on the low end of
Mm-hmm.
who comes in my office. But I was just telling somebody, I have about 30% of males that
Wow.
comprise my practice. So it's a little bit higher than the national average.
Gotcha.
And it's really important to respect those facial proportions because we see a lot of bad plastic surgery out there. That's what gives things a bad name. We see celebrities,
Where they look
Burt
like they-
Reynolds, Barry Manilow, you know,
Yeah.
their facial features have been really distorted, unfortunately.
Right.
And that's what people focus on. And the males see that and go, I don't want to look like that.
Sure.
So it's our job as physicians and injectors and surgeons to really make sure that we don't distort facial features.
Sure, sure. So then in your experience, would you say that, because I know for men it's, we have our egos and it's still more of a taboo for us to, maybe get some cosmetic procedures or even non-invasive treatments. In your experience, have you seen over the years that taboo kind of
That taboo
removing?
is lifting for
Okay.
sure, and it comes with education and maintaining a natural look for people.
Okay.
There's something to be said about subtleness
Yeah.
when you're enhancing your facial features. And none of us are too good for anything to be done to our face. We
Right.
all need a little something. That's what I
Right.
tell people.
And everybody's definition of subtleness is different depending. I'm in Los Angeles,
Right.
so
Yeah,
subtle
exactly.
Los Angeles versus
100%. I mean, I'm in DC, right? We're
Yeah.
conservative there.
Right, right.
And so we don't see a lot of lips that are coming out to here
Right.
or, cheeks that are going out to there.
Sure,
You're
sure.
definitely more exposed to that in the LA market. Even the New York market is very similar to that. So
Absolutely.
I'm very fortunate that subtle is acceptable where I live because
Yeah.
I don't think I could ever do the extreme versions
no.
of that.
That's my always. You bring up like Barry Manilow and all those kind of almost botched procedures, and you always ask. The first question I ask myself is how did it get to that point?
I know, and when you look at the pictures, you understand. It's almost like a body dysmorphia in a
Yeah,
sense,
like an obsession.
and a lack of their physician treating them, being able to just be like, stop.
Yeah, it's too much.
There's something
too
to
many
be said.
people willing to take the money versus doing the right thing.
Right, doing the right thing, exactly.
Yeah, totally. Anything else about the show that what are you looking forward to taking back to your patients? Maybe something you've learned.
I always take away something when I
Yeah.
come here, and I sit just as long in those lecture halls as everyone else, regardless of how much I'm speaking. And I saw a lot of good injectable advice today in terms of people's techniques. And, we all have our own techniques and we
Yeah.
have our way of doing things. But, when I go back there, I like to step outside of the box and try something new and see how it works.
Yeah.
And my patients really appreciate that as
Sure,
well.
sure.
They think of me as, really on the cutting edge of things.
Cool.
And so
Yeah.
I'm
That's a good
bringing
place
that
to
back
be.
to them.
It's a good place to be.
Yeah.
Okay, so kind of talking about that then, there's a lot of, it's not just plastics, it's not just facial plastics, it's not just ocular, there's some derms here as well. Talk to me a little bit about the importance of bringing kind of those different specialties together and the different approaches and how you can kind of work together to come to maybe the best approach.
Yeah, I think the power of collaboration is so important at these meetings because, like I just said, we all have our different ways of doing things. And, as surgeons, we have our own way of thinking and assessing and things like that. But, to see our dermatology colleagues, non-surgical people, assessing and addressing the face and achieving sometimes the same results that we can achieve surgically
Right.
is sort of mind-blowing,
Right,
but in
right.
a sense humbling,
Yeah,
because we can certainly do that. And it just
Yeah.
gives us other alternatives to offer to our patients to be
Cool.
like, hey, I think we can do this
Sure.
maybe in a non-surgical way.
Cool. Like it. Last thing. So one of the things I really like about this meeting versus some of the other ones, and some of the other ones do this as well, but there's an emphasis on complications where people are being vulnerable, they're being honest, and they're saying, hey, here are my complications, learn from them, versus, some shows where they're, I'm perfect, I have never made a mistake. How important is it that these doctors can come here and just be truthful?
I think it's so important to leave your ego at the door.
Yeah.
And to be able to freely talk about problems you've had. That's the only way we learn from each other. If we all had perfect patience and no complications, none of us would ever learn from each other's mistakes. Sure. And so I appreciate someone so much more when they come out there and they say, shouldn't have done this. This is why.
Yeah.
And we all sit there and go, oh yeah, I had somebody like that too, you know? I shouldn't have done that either.
Right.
Good call. And then we take that back home and we're just so much more educated and so, just so much better.
Yeah. Cool. Good stuff. All right. Well, thanks for joining us. I really appreciate
thanks for
it.
having
Good
me.
conversation.
That's awesome.
Have a good rest of your meeting.
Thank you so much.
Yeah.